Does anxiety cause schizophrenia? If you're wondering whether anxiety can lead to schizophrenia, you're not alone. This question is important because it helps us understand the complex relationships between different mental health conditions. To start, let's clarify that anxiety and schizophrenia are two distinct mental health disorders. Anxiety is a common experience that most people encounter at some point, often as a response to an anticipated threat. However, when anxiety becomes overwhelming and interferes with daily life, it can be a symptom of an anxiety disorder. Schizophrenia, on the other hand, is a serious mental illness characterized by symptoms such as hallucinations, delusions, and disorganized thinking. It affects how a person thinks, feels, and behaves, and it is usually first diagnosed between the ages of 16 and 30. Now to the question, does anxiety cause schizophrenia? The short answer is no, anxiety does not cause schizophrenia. There is no evidence to suggest that anxiety alone can lead to the development of schizophrenia. However, there is a significant link between anxiety and schizophrenia. Studies have shown that anxiety is a common feature in the early stages of schizophrenia, particularly during the prodromal phase before the onset of psychotic symptoms. In fact, heightened anxiety can precede the development of even attenuated or prodromal psychotic symptoms. Additionally, genetic risk factors for schizophrenia are associated with increased anxiety levels. For example, individuals with a high polygenic risk score for schizophrenia often exhibit higher levels of anxiety and negative symptoms. Anxiety can also trigger or exacerbate symptoms of schizophrenia. For instance, stress, abuse, migration, and substance misuse can increase anxiety levels, which in turn may contribute to the development of psychotic symptoms in individuals with genetic and environmental risk factors for schizophrenia. It's also worth noting that approximately 65% of people living with schizophrenia experience symptoms of anxiety, with social anxiety disorder being the most prevalent among these. In summary, while anxiety does not cause schizophrenia, it is closely linked to the disorder. Anxiety can be a precursor to psychotic symptoms, and managing anxiety can be an important part of treating and preventing psychotic relapses in individuals with schizophrenia. So, if you or someone you know is dealing with these conditions, understanding this relationship can be very helpful in seeking the right treatment.